Garcia, one of the sports knee and shoulder surgeons here. We're going to show a patient. This is a gentleman that had a previous subscapularis repair, or repair of the rotator cuff in the front, which is already sort of an unusual injury. He had it fixed around 3 years ago, and unfortunately it retore. The problem was that it had retorn chronically, so it was almost 6 months to a year old. And when this happens, especially in that muscle or that tendon, it's pretty much unrepairable. And this is a very challenging issue to deal with, which is why he was referred to me to try to have this taken care of. There are a number of different options you can do, but a newer option is we actually take a skin graft and do what we call an anterior capsular reconstruction. So a skin graft, a piece of skin, 3 to 5 millimeters thick, and actually attach it to the front of the shoulder, and it actually helps with giving that ability to not make you feel like you're going to dislocate, which she was having a lot of, and it gives you some coupling so you actually feel a little bit stronger. There's no actual muscle force in this, but you can see the results of this are pretty impressive, and this is one of the few cases we have in the state of Washington of this type of surgery. So we're really happy with his result. You can see from him, and thank you.
So I had surgery on my shoulder before I injured it playing hockey, and that repair did not keep. So I came to you. Actually, I did not know that, but I came to you with feeling like my shoulder was going to come out of socket. It was the feeling I had. Fitness-wise, I was still doing a lot of different things, but felt like something was going wrong in the shoulder. So that led to finding out that ligament had not, it had torn again. And we talked through the process of the limitations we had to reattach that ligament this time, a second time, and then leading towards going to the new type of surgery. And the confidence there was that, you know, my goal was to get back to playing ice hockey. I have a son who plays, so this is the direction that doctor and I felt was the right direction to get there. Honestly, if anything, I felt like I recovered quicker, better than that. You know, being optimistic with it myself, I felt like I was in good shape coming into this, but it did happen quicker. I had expected to have more limitations at having surgery twice on the same ligament, but I honestly feel like there's very little limitations now that I feel, and I feel like I can overcome them too as well. Going into the surgery, the expectations were that I was going to recover. I would be able to get back to playing ice hockey, but there was possibly going to be some limitations, and I can honestly say I don't know if there's any of those limitations left. I have very few limitations in movement right now, and I feel like I'm gonna overcome them as well because I've come so far. And having said that, I'll be able to do. I am able to do today everything that I had set my goals at, and sky's the limit. I'm sure that it's going to just continue to progress that way.